Let's take you to Hohoi. The Volta Regional Hospital in Hohoi is in a very deplorable state. The traditional authorities there are speaking about it. Our correspondent Despon Selasiago visited the place and filed this report.
The paramount chief of the Gbi traditional area, Togbega Gabusu VII, during a working visit to the Volta Regional Hospital, did not mince words, describing the facility as a death trap. According to him, the hospital's elevation in name from a municipal hospital to a regional hospital has not translated into improvements in structures and equipment. He noted that many of the buildings remain largely the same when the hospital operated as a municipal facility, despite now serving the entire Volta region as a referral center.
What we'll be hearing is not far from what we have seen ourselves today. The hospital, indeed, is a death trap, let me put it that way. It's not fit for a place where patients have to be attended to. Unfortunately, the facilities we have seen over here today are not facilities for a regional hospital status. These are facilities for district. Meanwhile, this is a strategic place for a regional hospital, which is on the eastern corridor, which will not only serve the people of the Volta region, but the people along the eastern corridor through to the north.
He stressed that a regional hospital must reflect modern healthcare standards, warning that failure to address the deficiencies could have serious consequences for patients and health workers alike.
There should be an upgrade of facilities. So we are just appealing to the authorities. Because of the lack of facilities that we enjoy in the hospital, a lot of specialists are not willing to come in here. The motivation of staff, as we can see, is very low.
Meanwhile, the administrator of the hospital, Divine Aki, has revealed that the Volta Regional Hospital does not have a surgical ward and an intensive care unit, describing the situation as a major setback. He explained that in the absence of a surgical ward, post-operative patients are managed in general wards, leading to congestion and limiting proper monitoring after major surgeries. Mr. Aki, however, appealed to government and relevant stakeholders to urgently expand infrastructure, equip the facility with modern medical technology, and establish the needed specialized units truly deserving of its regional status.
Infrastructure-wise, this hospital do not have a surgical ward, which is one main unit that you have to find in a regional hospital. The surgical cases are still being treated together with the medical cases in a ward, like a male ward, female ward, C ward. But a surgical ward will have cases that are only surgical. We do not have intensive care unit as a hospital. The recovery ward in the theater is only for 4-bed capacity.
Wow. This is a troubling one there, and it's the Volta Regional Hospital in Hohoi. Roofs leaking, not having enough beds, and also not having a surgical ward. This is serious, and also has to also deal with issues with doctors accepting postings to the area. Not long ago, we saw a communique or some sort of message coming from the health ministry, at least, urging new doctors or doctors to accept postings to sort of rural areas and places that ideally they wouldn't want to go. But if you're having a facility of this nature, what becomes of my decision as a doctor to decide whether I want to go there or not? This is a very serious issue. And I like the fact that, Chris, the traditional authorities have waded into the conversation and they are talking about it. You know, ideally, they would want to support, but it has to go through the right channel, that is the government, for the government to also come on board and sort of help in this regard. But we have Desmond Selasi Ago, our Volta regional correspondent, joining us. Desmond, good morning.
Good morning, Philip.
Okay, in your report and also conversations we have had, this is actually the Volta Regional Hospital that is in Hohoi, right?
Exactly.
Good. Let's understand. We also know of Trafalgar. We know of the whole teaching hospital. Isn't that a regional hospital?
Okay, Philip, thank you very much. So the former Volta Regional Hospital, popularly known as Trafalgar, was in 2021 or 2020-2021 upgraded to a teaching hospital.
Okay.
making it possible for the Hohwe Municipal Hospital back then to also be upgraded to a regional hospital. So we have Trafalgar as a teaching hospital, and now the Volta Regional Hospital in Hohwe.
Okay.
So there are two now.
So now we have two regional hospitals.
We have a teaching hospital and a regional hospital.
Okay, so a teaching hospital, which is Trafalgar, and we have the regional hospital, which is in Hohwe. Good.
Hohwe, exactly.
So when you visited the place, we are seeing on screens the surgical ward. We understand is not in good shape. We've seen that the roofs are leaking, the beds aren't enough. The place is actually weedy. What exactly can you tell us more about the concerns they are raising as a facility and also the traditional authorities?
All right, thank you, Philip. What we are seeing on TV is just a 3-minute report. But when you go to the facility itself, it's very bad, Philip. I should put it that way. Roofs are leaking, beds are very old, and some don't even have the mattress on it. Some of the mattresses are even torn, where the doctors and nurses will go to change. It's in a bad condition. Patients' relatives don't have a place to sleep. The OPD is also in a terrible condition. Roofs are also leaking there. There are inadequate furniture in the facility, where people will even sit when they come in to the OPD. It's also limited. Doctors' bungalow is in a bad condition. Some don't even have the facility to sleep in, so the hospital has to rent for them outside the hospital. So emergency cases, especially in the night, are difficult to manage because doctors have to drive all the way from the Hohwe Township into the facility. Now here lies the case in City of Health and Allied Sciences. It's also having another campus in Hohwe, and this is situated in the Volta Regional Hospital in Hohwe. The Fred Newton Binka Public School of Health in Hohwe is situated in that same facility. So it's putting another pressure on the regional hospital because they still have to share the existing facility with this very institution, that's the University of Health and Allied Sciences. But mind you, this facility we are saying was constructed in 1952. And since then, there have not been any addition to the facility. Addition meaning the infrastructure-wise, there's been no addition to it.
You didn't say 1952 or 62?
52.
52, okay, good.
Yes, 52. And now that it's even been upgraded to a regional hospital, the needed upgrade to make it a befitting regional hospital has not been seen for about 5 or 6 years now. We still not seen any infrastructure development in the facility. Although there are some few developments bringing up, unless those were done by the Assemblies of God Church. Aside that, nothing really is happening in the hospital. There's no ICU, there's no surgical ward, so surgical cases are still managed in the medical ward. And this is not safe, or this is not good for the health condition of those who are just coming out from the surgical ward. The theater is very small. It can't contain enough people. The emergency unit is very small. The dialysis unit, they only have two dialysis machines in the facility. And it's putting a whole lot of pressure on the hospital, because the hospital takes care of those in the Volta region. Aside the old teaching hospital, people coming from OT also go to that same hospital, because we have one bigger hospital in OT, that's the Rara hospital, which is now a district hospital. Three countries, Togo, also visit that same facility. So you can just imagine the number of people who come to this facility every day, comparing it with the existing materials or equipment they have in the hospital. So in a nutshell, the hospital is understaffed, because nurses and doctors sometimes don't accept posting. Specialist nurses and specialist doctors are also non-available. The few we have are not enough to take care of all these cases. So I was speaking to the administrator of the facility. He told me they need more, especially infrastructure-wise and also staffing. So Philip, these are some few challenges at the Volta hospital in Hong.
All right. So, at what point did they realize that look, this is deteriorating?
Okay, so the hospital itself has according to the administrator, have made some appeals to the authorities, but for now they've seen little to no result.
Mm.
On the side of the traditional authorities, they are the ones for the software or the traditional aid. So with the reports that have been coming to them, they decide to embark, see what's the issue there, add voices to that of the staff, and see if something good can come out of their stuff. So in all, they are also calling for the needed upgrades to be done at the facility to at least make the hospital a befitting one for a status of a regional hospital in the Volta region here.
Right, and from what you've just narrated, it seems like people just keep coming in as much as is deteriorated. So that means they're doing a good job as a hospital, just that they do not have the infrastructure that they need.
Yes, service delivery is a top-notch one at the facility. I believe if they are able to needed assistance, they can even do more. And that's to even ease the pressure on the whole teaching hospital, because most cases are referred to the whole teaching hospital. Some are also referred to the Kolego teaching hospital.
Right.
But if they are able to get this equipment at the facility, I think the regional hospital can also be a referral point for cases from minor facilities such as the chief compound, the district or municipal hospitals, to the bigger hospital, which is the Volta Regional Hospital.
All right. So from this 3 minutes video that you just showed us, or what we are watching right now, I can see that the beds are nothing to talk about. But if somebody has to be on admission, where does the person stay?
So that's one of the biggest challenges of the facility or in the facility. Inadequate beds, inadequate wards, and even the place for patients relating to sleep are all challenges. So we now see overcrowding sometimes in the facility. Most cases are even referred to the whole teaching hospital, which is also putting a burden on the whole teaching hospital. So it would be prudent if the needed infrastructure is put up at the facility. It would be prudent also if the needed equipment, the needed beds, mattresses, and what have you are brought to the facility. I think that will uplift the image of the hospital, and also service delivery we can see much better service delivery at the facility.
Okay. Well, you are not a worker there, neither are you a doctor there, but I want to ask you a few questions pertaining maybe what you gathered from the administrator. How many patients do they receive in a day?
So from what I've seen, or from what we have been able to gather, about 1,000 to 2,000 patients are received at least every day.
A day. And what is their staff strength?
The staff strength is about 550. That's including the orderlies, the nurses, the doctors, those who work at the kitchen, and the ICT department, and so on.
And this is
go
ahead.
I indicated earlier that we even see people coming from neighboring Togo, because Togo is not far from the Hohwe municipality.
Yeah.
From Hohwe, we are entering into Togo. There's a border even at Uli. So you can just imagine the number of people coming. People come all the way from Tamale to the Volta Regional Hospital in Hofwe to seek for medical attention. People come all the way from Afaja to Bandu and Fuega all the way to the regional hospital now because they feel coming to who will even put more burden on the facility, which we already know there's a burden there. So at least they feel if they go there, they might be attended to quickly. But now that the needed infrastructure are not available, it's also putting the toll on the Volta Regional Hospital in Hong Kong.
We wish we got to the administrator so that we could ask him how they are able to generate funds. But I'm sure this facility takes national health insurance, right?
Yes, they do.
Good. So aside the big traditional authority going there, or the paramount chief of the big traditional area going there, did the administrator tell you that other authorities have been there, i.e. the Volta regional minister or the MC for the area or the member of parliament for the area, or even officials from the health ministry have been there to maybe assess the situation before the visit by the B traditional authority?
Okay. Last year, a working team from Parliament was in the region. I believe they were at the hospital because I know they were at the Volta Teaching Hospital. So I believe they were at the Volta Regional Hospital in Hofwe. Aside that, I am not too privy on any other stakeholders visiting the facility. That is the MP, the Volta Regional Minister, or the Health Minister. But for the working team, I really believe they were there.
Okay. Thank you so much for your time. That's Monsalasiago. He's our Volta Regional correspondent, and he brought us that troubling story on the situation of the Volta Regional Hospital in Hohoi. The reason why we had to clear the air on the fact that is no more Trafalgar, which is the whole teaching hospital, but it's now in Hohoi. So that tells you that, like the way when you come to Accra, we have Kolebu Teaching Hospital, and we have the Greater Accra Regional Hospital, which is Ridge Hospital. So in this case, we are talking about Ridge Hospital, which is in the Volta region. So that is the Volta Regional Hospital in Hohoi. And if you should have a facility of this size, in this shape, it tells a lot of our health sector in this country. But the B Traditional Authority went there. That is Togbega Gabusu the 7th, the paramount chief of the B Traditional area and president of the B Traditional Council. He described the Volta Regional Hospital at Hohoi as a death trap. And from the videos you can see, the video producers want to put the videos on the screen so that you see the videos for yourself. He described it as a death trap in providing effective and efficient health care. So he said, we decided to have first-hand information on all the issues that we have been hearing, and lo and behold, they are not far from what we've seen ourselves. The hospital indeed is a death trap. Let me put it as it is. This is coming from Togbega Gabusu, which he said. And he still went on when he was briefing the media of an unannounced visit to the hospital in the company of other traditional authorities that disclosed that the hospital was not fit for a place where a patient had to be attended to. And this is unfortunate. He said that the facility the facilities at the hospital did not befit the status of a regional hospital. So something has to be done about it immediately, because it's not befitting, or it doesn't befit the status of a regional hospital. And that's, as a matter of urgency, traditional authorities, traditional council, and the citizens were calling on authorities, the member of parliament, municipal chief executive, regional minister James Gunu, which we know you are doing a very good work. Maybe you'd want to also go there and also see the issue for yourself. The regional minister and the health minister Kwabena Minta Akando. You would also want to go there and see the situation for yourself to strictly respond to their plight. Well, a call was made on the member of parliament for the area, And he's joining us, Thomas Walanyo Chepo, who is joining us to let us understand what his outfit is doing about this, and if he has really seen or visited the place to assess the situation for himself. Good morning, sir. I trust you are doing well.
Yeah, good morning, my brother.
Okay.
Yeah, I'm doing very well.
We thank God. This morning we are talking about the Volta Regional Hospital, which is in your constituency. Have you visited the place yet, and what can you tell us?
Yeah, thank you very much. And good morning to your viewers and listeners. It's true. I visited the place before even the Tobagan went there recently. And I agree with him, all of what he said. I perfectly agree with him. The situation there is very, 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 very bad. When I became MP a year ago, that was the first thing I did to get a first-hand information about the place. And I can tell you that even bed is a problem. In fact, there is nothing, because when the place was a municipal hospital, even not up to a standard of the municipal hospital, before it was renamed under the previous regime as a regional hospital. So it is through our efforts that they were able to get some equipment that they are currently using. The first lady, Her Excellency Lordina Mama, was the one who came to our aid with even incubator. We were not even having incubator in the hospital. So it's a situation that I have discussed with the health minister, and probably before the month end, he traveled. Maybe I don't know whether he's back, but he's promised me that when he arrived within the month, he will go with me to assess the place. The original plan is to renovate the place and then also build a new hospital. And that's a long-term plan. The chiefs have graciously given us 100-acre land that we have visited to assess. And we are now, what we are pushing for is a renovation and then equipping the place for now before the actual regional hospital is built. So I agree with Obega that the place is a death trap. I wish your reporter could visit the place again. It is not a place to be called even a chief compound. Yeah, but we are managing it because, as I said, we took over just a year ago. And what they are using now, the equipment, most of the major equipment they are using now, is because of our help and the help of the first lady that we have them. But I can assure my people that as your MP, we are doing everything possible, because that will be my first point of call if something should happen to me in the constituency. And where is it situated? It's between the south and the north. That's the Eastern Corridor Road. And everybody's life depends on it. That's why we are pushing, doing everything possible to see to it that the renovation is done, it is well equipped, before we start thinking about building or constructing a new regional hospital, which we promised our people in our manifesto.
All right. So, what's the next plan in line for you?
Yeah. As I already said, the next plan is to move the minister there. In fact, we, all of us, are part of the policy makers, but they decide on what should be done at what time. So he has the resources to distribute. So we have planned that before this month end, he will go with that. That was the assurance he gave me when I spoke with him during at the weekend. He said he will go with me. So that immediately we look at how to handle the immediate situations before we look at the next day. So it will be in phase, the first day, second day, the next day. But the immediate action is to visit the place so that immediately we see what we can do to avoid the situation. All
right. So, but is there any possibility that, say, by the end of this year, that there should be a little facelift to the hospital? Because exactly. It's actually a very important hospital.
Exactly. That's why I agree with the Togwega for saying it's a death trap. I have also made such a statement before that it's a death trap. So before the end of the year, when the minister comes, I know he will outline. I don't want to take words from the mouth of the of the minister. He told me, but I want you to come from his, he himself when we visit the place in course of the month. There's a plan to do some work to be fit. Even if not the standard of a regional hospital, at least a municipal hospital, because as I said, it doesn't befit even the status of a municipal hospital. So if we can do something about it, we will let you know. Not that if something will be done about it within the year, while looking at the second phase of getting a new place. But I can assure you, and I know your reporters are on the ground.
Yeah.
But before the end of this month, the place will visit the place, and whatever that needs to be done, we will see to it that we do it. Because health is everybody's priority. It need not to be just the talk. That's why we don't talk about it. We've taken certain actions that the people themselves have seen. If you listen to the earlier comments of Tobega, he applauded us for the earlier steps that we have taken. But how it is now is not up to the standard that he wanted. And it's not about what he wanted. It's about the community. And he's crying for the community. And I'm a witness to whatever that he has said. And I want to assure Tobega and the people of Okwe that within the month, as I have assured him, we will come, and then the steps that we have outlined will be taken.
Thank you so much for your time. It's up by close of month, so we will definitely be visiting the place again to see how it will look like before, after the month ends. Thank you so much.
I would like you to follow up on the story. You are the first station that has reported this, and then we will assure you that through City News, Hokowek Hospital, Regional Hospital, will get a facelift.
Beautiful. So we'll be monitoring closely, and if anything you'd want to share with our reporter or with us as to the updates, then definitely you'll be given the coverage that it needs. Thank you so much for your time.
Very well. Thank you.
So that is the Member of Parliament for Hohoaya, Thomas Walanyo Chepo, who actually spoke to us, and he has assured that some form of work will be done. We are just hoping and praying that that form of work that will be done, that renovation that will be done, should be done immediately, so that individuals who use the facility will now heave a sigh of relief, so that when you go there, you know that I'm going in there to get health care. I'm not really going there to go back home with another ailment. So it's very important. That has something that has to be dealt with. So from the administrator of the facility, that is a Divine Aki, he mentioned a number of things that the facility actually needs, and I will be mentioning some of them here, and we are just hoping and praying that the authorities will now monitor keenly and get these things done. So the hospital lacks intensive care units with only 4 theater bed capacity. It presents a woefully inadequate strength because of the huge number of daily cases, as well as referral, including obstetric and gynecology emergencies. He also said that the facility also lacked accommodation for specialists. Hence, the hospital must be compelled to rent for doctors so they could stay and work. Getting a place for the health workers is very important, so that one will also have to be looked at. But this particular facility, which our reporter made mention of, that is Desmond Selassie-Ago, is that it was commissioned in 1952. So that is some 74 years ago. Yes, if my math is correct, is right.
So
Some 74 years.
Ghana.
Yes, Ghana is 69. And if you have a facility that is 74 years, by now we should actually gotten a better facility by now. But looking at the way that facility is in, it's nothing to write home about with the current building, and hence the urgent need for its infrastructure to be upgraded. He called on stakeholders, including individuals, and this we are also calling because the government cannot do it all. So please and please again, stakeholders, individuals, organizations, to support the hospital in addressing the challenges it currently faces. So as part of your corporate social responsibility for this year, you would want to think of the Volta Regional Hospital, because we are having about 1,000 to 2,000 people using the facility each day. It's in a very deplorable state. You may not know where you find yourself tomorrow, and you would have to be taken to this facility. But if you are able to contribute your quota to this particular facility, it's actually going to help for us to save the entire public that visit this particular facility. So the MP has given his word. I'm sure that his word will get to the health minister. The Volta regional minister also come into the picture. Thank you so much, the traditional authority, for also going there to check the situation for yourself. That is a big traditional authority. I think that's it. It's okay.
Yeah.
And we'll be monitoring and watching closely.